Hello, everyone. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. And before we start, we would thank Universe for giving us this great opportunity with Gayatri Mantra chanted by Professor Regina from Brazil. Would you like to chant Professor Regina, please?
Thank you very much. Om Bhuvat Swaha Tat Savitur Varenyan Bargo Devasya Dhimahi Dio Yona Prachodaya. Many blessings to the universe. Thank you.
Thank you. And welcome to Ka Homeopathy Study Group Pro Bono webinar hosted by Kavita Holistic Approach. I would like to take privilege to say that our Ka study group is very unique Homeopathy Pro Bono study group from the United States of America, which formed to unite world-renowned practitioners throughout the globe. Ka's mission and vision are very unique to inspire young homeopaths. Mentor, provide excellence for educational purposes using holistic approaches via webinars, which provide professional continuing educational homeopathic credits for practitioners. We follow the principles of classical homeopathy and invite speakers for HNI accredited webinars. We value and treasure the human collective as our honorable peers. We provide merit certificates for spreading the light of homeopathy worldwide while celebrating stage 4 cancer survivors through our inspirational book talks. These webinars for educational purposes only and see an expert homeopath for treatment. This is Kavita Kokunur, board certified homeopath from Michigan, USA, President and CEO of Kavita Holistic Approach, founder and director of Ka Homeopathy Study Group. I'm outreach coordinator of CHC PR committee, encouraging homeopaths to become CHC certified. As HNA CPD provider, encourages homeopaths for HNA accredited webinars. I'm member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. I sincerely thank Ka Homeopathy Study Group entire team for their continuous support. This webinar is moderated by Ka family, Dr. Sweta Singh, Chief Administrator, and Professor Regina Rianelli. It is being recorded as we speak and we are live on Facebook. Today, March 21st, 2021, and we have two honorable speakers. Today's webinar topic is Homeopathy in Pathological Conditions by Dr. Sanjay Modi. And at the end of the webinar, we have Executive Director Holly Manoogian speaks about homeopaths without borders. So please stay tuned until the end of the webinar. Hello everyone. Let us welcome our honorable speaker Holly Manoogian. Holly Manoogian is a nationally certified in classical homeopathy through the Council for Homeopathic Certification and has over 25 years experience working with non-profits as a director, consultant, board member, and program staff. She arrived at Homeopathy Without Borders as a volunteer during the May 2011 service trip to Haiti. She assumed duties as executive director in August 2011. Holly holds a Master's of Science in Teaching with a focus in environmental studies. She is trained at New England School of Homeopathy with additional clinical training in Mumbai, India. She is the co-founder of Youth Empowerment Program in New Hampshire, where she served as coordinator for 20 years. In this capacity, she worked closely with schools, community agencies, and families. She trained and supervised staff and frequently organized and led cross-cultural and service learning experiences for teens and adults. Let us welcome Holly to our webinar.
Cheers.
Wow. Thank you, Kavitha. It's really a pleasure to be here with you all today. Thank you so much for inviting me.
Thank you, Holly. And if you don't mind, we have Professor Regina chant Gayatri Mantra, small prayer, thanking universe for giving us this great opportunity.
Om Bhuvat Swaha Tat Savitur Varenyan Bargo Devasya Dhimahi Dio Yona Prachodaya. Many blessings to the universe. Thank you for such honor having Holly with us today.
Oh, it's my pleasure to be here with you all. So I'm going to share some pictures of our journey. And whoops. All right. Do you have me on full screen there or no?
Not yet.
I'm clicking it, but it's not getting there. So I'm just going to start and maybe you'll see my sidebar here anyway. Is that all right?
It's okay.
Okay, well, anyway, so here we are with Homeopaths Without Borders. Actually, we're celebrating this year 25 years of providing humanitarian service in North and Central America. In 1996, the founders of Homeopaths Without Borders brought together professional homeopaths who were licensed and non-licensed, homeopathic educators. We have home users and advocates of homeopathy. And that's who we are today. All of our work has been made possible because of the efforts and generosity of so many volunteers and, of course, donors. Our service projects are built on collaborative local partnerships with the intent of assisting nations, regions, or local areas to grow and sustain homeopathic educational and clinical programs to meet the local needs. So now we have 3 program focuses. Each of the program really helps to build on the community's ability to integrate homeopathy, besides providing care to the many people that have no access to healthcare or homeopathic services. So we're really interested in teaching people to serve their own communities and not go into a new area and set up a home there, even though we totally enjoy being able to work so collaboratively with communities. So the first program focuses of our interests focuses on education programs. We have 2 practice-based homeopathic courses that develop the essential skills to provide homeopathic care. The Fundamentals of Homeopathy course focuses on treatment for acute, emergency, and common clinical care conditions, with an emphasis on epidemics and infectious disease. And of course, this was all before the current heightened pandemic we're living through. Within this curriculum, there are therapeutic reference charts. This one is on gastritis and indigestion. And then we also have created these materia medica diagrams. And we've kind of boiled down to highlight the key characteristic symptoms within those therapeutic needs or addressing the medicine itself to help the homeopaths focus in on a cluster of remedies they could consider. We've taught this course to both medically licensed and non-licensed students. So for example, in Haiti, we developed this course and program and started working with the Ministry of Health there. They reviewed our curriculum and approved it and encouraged us to seek out the Haitian Medical Association, who also reviewed it and then started co-sponsoring our courses that we were teaching there. So it really is on a national level that they're looking at integrating homeopathy into their healthcare system there. The other course we developed is the fundamentals for the homeopathy for the childbearing year. This course specializes on homeotherapeutics for common conditions during prenatal, labor, and delivery and postpartum, as well as emergency conditions. This course, we were fortunate to partner with a government hospital in Haiti when we first launched it. This was a very, very busy maternity hospital that had up to 500 to 600 births each month. So a very, very busy hospital, and we're really proud that we were able to work with a great team of nurses and midwives and doctors there to begin to integrate homeopathy at that site. Both of these courses are about 90 hours, and we break that up into classroom didactic teachings, and then the other half is in clinic where the students are really getting hands-on experience right from the start. Volunteers are an integral part of these education programs. They come and they may teach part of the curriculum that we're working on, or they will mentor a group of 3 to 5 students during the community clinics, our practice clinics, or they volunteers can just help with the operations or staffing dispensary. These 2 curriculums were developed from Karen Allen and Lauren Fox, brought their educational and clinical wisdom to help write these curriculums, and they're published. The fundamentals of homeopathy curriculum has, besides them being part of our core curriculum, they've been used at a homeopathic school here in the States and as part of their first year program. We know it's being used at a nursing college for an intro to homeopathy course. Study groups are finding them very useful. Home users also have written to us that they like the format and the ease of using the curriculum. Our second focus area is with our emergency response teams. We are set to mobilize emergency response teams of experienced homeopaths to respond to local, national, and international endemics and natural disasters on the ground, and now via telehealth. The ERT teams that first went to Haiti in 2010 were guided by Shushila Lansing and Lori Grossman. They did an incredible job first of getting a team into a demolished, devastated area in Haiti, and then they set up tents in a demolished hospital parking lot and began serving many hundreds of thousands of injured people. Other teams have responded to a national chikungunya epidemic, cholera epidemic, a devastating hurricane in Haiti in 2016. And then when the current pandemic landed, we set up a dedicated team via call-in line to provide free consultations to people experiencing symptoms related to the current pandemic. When our ERT teams are on the ground, we work as part of a local integrative healthcare team, and that it helps ensure that the patients receive adequate follow-up care and the homeopathic products they may require in the future. We are very committed to modeling and ensuring that people get ongoing care once we start introducing homeopathy into their areas. And you'll see this as I talk about the next focus area, which is mobile clinics. They've been a lifeline to hundreds of thousands of people This program brings teams of Homeopath Without Border volunteers to areas lacking access to healthcare, and sometimes just areas that may have healthcare available, but it's not consistent with people's belief in working with medicines. So they are welcoming of a holistic approach to their health. Over the years, we've served over 10,000 people in cities and remote locations at mobile clinics in Haiti. And due to the current situation, we've been unable to travel to Haiti for the past year and a half. But we're proud to report that the mobile clinic program there has now been transitioned to Dr. Joseph Prosperer and the graduates of our courses in Haiti. So now what's happening is each month they send out a team of homeopaths. From 4 to 6 homeopaths go to a new region, and we'll do a clinic for 2 days. And then a month later, the team will return to do their follow-ups. And beyond that second month, the homeopath that lives closest to that area will continue with the rest of the follow-ups. And then in the meanwhile, the team then transitions and moves to another new location in the country. And this is the program that they have set up. And we are very proud of their work, and they're starting to send data out from these clinics as far as the numbers they're treating, the conditions, and how the people are assessing how they responded to the homeopathic medicines. So we'll be doing that ongoing. And in the meantime, we're working to, or trying to raise the money that's necessary to keep their teams moving out there in the countryside, which mostly means about maybe about $400 each weekend, and it provides their transportation, which is very challenging in Haiti, and then food and lodging when they're away for those weekends. So if you're able to help, come to our website, and you can make a donation there. Here in this country, we're just about ready to launch a community clinic in the United States. And unfortunately, again, due to the pandemic situation, the population is very concerned about being safe. So we are transitioning this clinic to be a telehealth program and ensure everything's in place to have it launch first as a telehealth program, and then we will be in person at a mobile clinic site. So if you're listening in from North America and would like to get involved with us, there are many ways to contribute, as well as if you know of an organization that would like to partner to offer one of these community clinics, they can get in touch with me at homeopathswithoutborders.org. So again, it's really a pleasure to be able to meet with so many of you, and I'm really appreciative of being asked to come and share what we're doing at Homeopaths Without Borders. Go to our website and sign up for our newsletter. It'll keep you posted as to where we're headed next, or what's been coming out of our work in Haiti and elsewhere. Thank you.
Thank you so much, Holly, for sharing this great information about the Homeopaths Without Borders.
Yeah.
And I would say it is a phenomenal work everyone is doing, and running these courses, clinics, and programs in Haiti. It is really huge. And greatly appreciate all your generosity and all the volunteers and supporting homeopaths like Lauren, Karen Allen, Laurie Grassman, and many more who are involved in this project, making it successful. That is really great. And Professor Regina, would you like to say anything, please?
Absolutely. Thank you so much, Holly. It was heart-touching presentation, and this webinar shows that homeopathy without borders embraces the whole planet. I myself have been working with homeless in the free clinic of Countess Paula for 11 years.
Nice.
I work pro bono only for 20 years in homeopathy in South America, Rio de Janeiro, Brazil, in the poorest area in town. So we give away the medication, we see the clients, we see single mothers, we see homeless, people with heavy duty drugs and alcohol abuse. And when we help someone we don't know, it enriches our lives because what we learn is precious and we are offering for free. I humbly think you are God's hands on planet. You are asking, you are working with love. And when you're asking people to help, they are helping our global family in natural disasters, when they lose their families, when they lose their homes, when they need homeopathy, but they also need food on their tables. And this work and the pictures you show touches our heart, because I guess this is what we know. It's a better word with your presence and your group, because this is what we want to see, people holding hands. And like the pictograms behind you, dancing with homeostasis, happy because they have a support system with homeopathy, which is gentle, efficient, and economical. Many blessings. I do hope you get from this webinar more and more volunteers to give a hand on such a magnificent project. It's human, it's gracious, it's wellness, it's energy medicine, and you are representing it. Bless you. Thank you for this great opportunity. Back to you, Dr. Kavita.
Thank you, Professor Regina. And Hole, through Kavita Holistic Approach, Ka is supporting the charity work Kevin Friendly Foundation, who the poor people serving their needs, school supplies, or anything who are in greater needs. And we all need many more charitable organizations to promote homeopathy and support the poor people who are in greater needs. And thank you so much once again. And we would like to take privilege to honor your precious time and sharing knowledge about Homeopaths Without Borders at our study group today with our caste certificate. Kindly accept it from our team, Holly.
Oh, absolutely. It's a real pleasure to meet you all. I hope I get to come back again and see you all sometime. Ah, beautiful.
Thank our Chief Administrator, Chief Administrator, Dr. Sweta Singh. She usually presents the certificate and it is here today. And we welcome you again at our upcoming webinars. And thank you so much. And if anyone has questions in regards to Homeopaths Without Borders and knowing the opportunities or anything, they can email us, castedgroup@gmail.com, and we can forward it to Holly, or you can directly reach on the website of Homeopaths Without Borders. And thank you so much. And do not forget to register at the JAC conference, which is on April 23rd to 25th. And it's a great opportunity have that one, they will get the $10 discount for becoming NCH member when you enter Kavita 2021. And thank you so much once again for your precious time, Holly. And we will see you again soon.
Okay, great.
And we will announce the upcoming events on April 11, 2021. We have Gabriel Trop speaks about live right for your remedy type. And also we have about Canadian Homeopathic Medical College by Dean Dr. Sharam. And we have many more renowned homeopaths lined up for our CA webinars and on April 18, Sujata Owens. So please tune to our study group on social media and other places. And first, I wanted to thank Ka Homeopathy Study Group team for the continuous support, and special thanks to our Ka Chief Administrator, Dr. Sweta Singh, and also Professor Regina. We have many Ka volunteers with us today. Thank you, Dr. Srijan, Dr. Mamata, Dr. Sweta Verma, and Dr. Uma. We appreciate everyone. As always, we thank all the participants for their presence and undivided attention. And do not forget to register to Jack conference. Please register at www.jhc.info, and it is on April 23rd to 25th. And they have the early bird registration until March 31st. And Dr. Sweta and Professor Regina, anyone in the team, would you like to speak before we wrap up?
Yeah. I would like to invite everyone to join our YouTube channel through Kavita Kukonor, plus the Facebook and the Twitter and the LinkedIn, because we always have news and journals posted and articles. And if you are willing to have a study group and we discuss and enrich the exchange of information, and this energy medicine goes all over the planet. And it's a blessing being able to participate, take part, have empathy to our fellow homeopaths. Namaskarams to all. Thank you.
Professor Regina and Dr. Sweta. Shall we end the webinar?
Thank you, all of you, and thank you so much, Dr. Kavita and CAR Study Group for this enlightening lectures. And that's all about it. You can reach us at carstudygroup@gmail.com, and don't forget to subscribe our channel, YouTube channel Kavita Kukunur, to get all the recordings of our webinar. Thank you so much.
Webinar. Until then, stay healthy and happy.